Hi, it's Dr. Kenny Levine with Health Talk. Welcome back. We're seen on WEYW19.com and on Uverse Channel 19. I'm here with Iris Cohen. Iris, in my periodontal practice, we prescribe medications for patients. The only ones that I really insist on them taking really are the antibiotics before surgical procedures. And occasionally, maybe it's more than occasionally, patients don't take the full dose of an antibiotic. Would you tell them from your point of view what the issue is with that?
Right. If you don't take the full course of an antibiotic, and these days it's usually short course, a 5-day, but let's say you feel better after 2 days and you stop taking it, that infection may not be killed yet. You feel better, but that infection can grow and come back worse than the original infection. And then
Germs
you have
get stronger,
infection.
right?
They get stronger and they're smart. Then you're going to try to give them the same antibiotic and they remember it and they say, oh no, this is not going to work anymore. I had this, I got stronger and now they're resistant to the original medication.
They don't really talk like that to each other. But what happens is they get a sub-lethal dose, let's say, they come back bigger and stronger than they were before, and then they need different medication. Let's talk about specific issues with specific medications. What are the most common things that you run across?
What I see is the patients in South Florida, they may not have enough money, so they stop taking all their medication. And some medications, you don't want to stop immediately. You want to taper them down. So you don't want to go into withdrawal. So if you're on something like Valium or benzodiazepines or even narcotic painkillers, you run out of your Vicodin or Percocet and you have cancer pain, you may have experienced some withdrawal symptoms, and we don't want that to happen. People with COPD, if they're on prednisone or another steroid to shrink the inflammation, those you don't want to stop immediately either. You want to taper them down, and also to start, you can taper them up.
I got it. You know, you talked about the patients having the right not to take their medications. And they can refuse the medications. And do you, as the pharmacist, get involved in counseling them?
Yes, I do counsel them, and I am a proponent. I believe in medications. I believe in FDA-approved medications. So if you're coming to the hospital and you have chest pain, and a doctor wants to give you an injection or tell you to, okay, take aspirin, 4 of these, and you say, I'm going to Google it up and no, I don't want to take this, well, you're hurting yourself. Medications only work if you take them.
As prescribed?
As prescribed.
The dosage, the frequency, and the longevity, the length of the prescription. You know, you talked about Googling it up. Patients are a lot smarter, or they think they're a lot smarter today, and there's a lot of misinformation out there, isn't there?
I would recommend they take the medication, and then if that happens, then we could change the medication. And some side effects you will get when you start a new medication.
Right.
But then you can work through it. Usually most side effects go away.
And most side effects, contrary to what most people think, are not allergic reactions.
No.
People say, oh, I'm allergic to this, I'm allergic to that. When we give injections, patient says, well, I'm allergic to epinephrine. Well, it's really not an allergy to epinephrine. It's a side effect of the medication goes away in a few moments.
Right.
Because every day I give people injections and they say, oh, my heart's beating fast. And I tell the women it's probably because I came in the room and that's why their heart's beating fast. But the palpitations that they would feel are short-lived, and there's really no allergies to say like that. Patients will come to you and say, you know, I'm prescribed 3 or 4 medications, and do I really need to take them? At some point you have to say, I would imagine, that you're not the doctor.
Right, I'm not the doctor, but if the doctor's writing for it, I would recommend that you take them. Because some disease states you just can't treat with one medication. High blood pressure, there's 5 or 6 different mechanisms of action. You have ACE inhibitors, beta blockers, calcium channel blockers, diuretics. So even though you think high blood pressure, there's not only one pill to cure high blood pressure. You have to go at it from all different angles and different mechanisms.
I know. In my practice, we talk about calcium channel blockers We'll get back to that in just a moment with Iris. It's Dr. Ken Levine with Health Talk. We'll see you in a minute. Thank you.